السلام عليكم ورحمة الله وبركاته. إن شاء الله هنتكلم النهاردة على Infection Control Guidelines Implementation in Healthcare Facilities. Today we will speak about the general practice for infection control implemented in healthcare facilities to prevent infection transmission inside the hospitals. Objective for this presentation: by the end of this presentation, you will be aware about the goals of infection control implementation, the meaning of infection control chain or infection chain, the meaning and types of healthcare acquired infection, the meaning of bundle and the bundle types, types of standard precautions, types of expanded or isolation precautions, medical waste management, and blood spill management. First point, the aim of infection control. Our aim at infection control in the healthcare facility is to prevent infection transmission between patient and each others, or between patient staff and staff visitors. So our role in the hospital to prevent all types of infection transmission. So this goal implemented by participation from everyone in the hospital. So we always called that infection control responsibility is everyone's business, from the higher administration to all levels of healthcare staff. This is chain of infection. The infection to transmit it from one person to another person, it required a chain. Started from the infectious agent, which may be bacteria, virus, fungi, then transferred to reservoir, in which the microorganism or the infectious agent will survive and multiply. Then he will find portal for exit through the secretion droplet. After that, the infectious agent will transfer to another person or another host by mode of transmission. This mode of transmission may be different in 5 types, maybe contact, droplet, airborne, vector, or vehicles, and we will discuss it later. After mode of transmission, he will reach to the new host and will enter to the new host through portal of entry. This portal of entry may be respiratory tract, GI tract, mucous membrane, skin, and intact skin. And that he will settle in the new host or suspected host, which may be new patient, may be another vector or another microorganism or another animal. This is the cycle, and we'll start a new chain of infection again. This is another shape for infection chain, illustrated by example for each component of it. Our role as infection control professionals to make break in this infection chain to prevent this infection transmission. And the most point we can break it is the mode of transmission, this area, by implementation of infection control practice or infection control guidelines. Okay, next point. What is the meaning of healthcare acquired infection? And what is the difference between healthcare acquired infection and the community acquired infection? As CDC, the definition of healthcare acquired infection, it is an infection which occurred to the patient at the 3rd calendar day, before we said after 84 hours, 48 hours. The definition changed now to be at the 3rd calendar day from the admission. And this infection not found or incubated on the admission time. In this case, will be called healthcare acquired infection. Otherwise, if the infection occurred to the patient before the 3rd calendar day, it will be community acquired infection. These are the most common types of hospital acquired infection. Central line associated bloodstream infection, which is called the CLABSI. Catheter associated urinary tract infection, which is called the COUGH. Surgical site infection, and ventilator associated pneumonia, VAP. If the patient has any device from this, and at the 3rd calendar day from the device insertion, he will got bloodstream infection or urinary tract infection or pneumonia, it will got hospital acquired infection. Surgical site infection, the period extended to 30 days from the operation. Okay, for this hospital-acquired infection, what are rules to prevent the hospital-acquired infection? This infection can be prevented by implementation the bundle or healthcare acquired infection bundles. What is the meaning of bundle? Bundle definition defined as simple sets of evidence-based practice that when implemented collectively or together improve reliability of their delivery and improve patient outcome and prevent healthcare acquired infection. For each type of healthcare acquired infection, there is a specific bundle or a specific group of procedures. These procedures, when implemented together, it will give more or perfect outcome for the patient and the patient safety, and will prevent hospital-acquired infection. But if this component implemented individually or not collected together, their effect will be very weak. So must be implemented together as in the shape or photo. These are the types of bundle. We have VAB bundle, COUGH bundle, CLABSI bundle, SSI bundle, and MDRO bundle, multi-drug resistant organisms bundle, to prevent multi-resistant organisms transmission. The definitions of healthcare acquired infections and the case definition for each one and the component of bundle, we will discuss it later, inshallah. So now we will talk about the general practice or general guidelines of infection control implemented in the hospital, which should be implemented all the time. We have, this is the most component of general control guidelines: standard precautions, aseptic technique, needle stick injury, blood spill management, staff immunization, and expanded or isolation precautions. As GCC, standard precaution include 8 components: hand hygiene, PPE, handling or disposal of contaminated items, lab specimen management, room cleaning, patient placement, cough etiquette, food and drink at workstation or medical area. The expanded precaution or isolation precautions divided into 3 categories. Based on this classification, it's very important to be aware about it. This classification based on the mode of transmission. Okay, we will start now by standard precaution. What is the difference between standard precaution and isolation precautions? Standard precaution is a practice or procedure which should be done with all patients, regardless their diagnosis, regardless they are infectious or not. So the standard precaution should be implemented with all and caring all patients as infectious. So it should be implemented with all. But the isolation precautions depend on the mode of transmission for infectious diseases only, not for all. And we will discuss it now on the new slides, next slides. Now we will start about the standard precaution one by one. First of all is the hand hygiene, is the cornerstone of infection control practice. Implementation of hand hygiene in regular routine ways, it prevents about 50% of the infection. So as we see in these pictures, our hands full of microorganisms, different type of microorganisms. If we neglect the hand hygiene, these microorganisms will transfer from one patient to another patient by the healthcare worker hands. For hand hygiene, it's very important to be aware about these points, the indication of hand hygiene, types of hand hygiene, procedures, and the duration for each type. If we talk about this is our hand. So this is our hands without hand hygiene, full of microorganisms. The indication of hand hygiene, which is called 5 moment. 5 moment. This moments, which is very mandatory for the healthcare workers to do hand hygiene. Before patient touch, before any aseptic or cleaning technique or procedures, after body fluid exposure, after patient touch, and after touch patient surround. So now, what are the types of hand hygiene? What are the types of hand hygiene? We have 3 types of hand hygiene. Surgical scrub, hand washing, hand rub. Surgical scrub assigned to invasive procedures, like in the operations room or insertion of central line. It will take about 3 to 5 minutes until we do it till our elbow. Hand washing using water and soap, and hand rub using gel or alcohol. And this is the duration for each type of them. This duration, which is called contact time. The contact time, which is very, very important to allow the disinfectant to kill or remove the microorganisms. And this is procedures. Of course, all of us know about it, and we have to learn our staff or our healthcare workers to do it on a regular basis. The sequence of steps of hand hygiene is very, very important. It's a basic for cleaning any surface, even our hands, to start from the least contaminated part to the most contaminated part. If we don't implement these steps, our hands will still contaminated and not clean. So the steps, which is covering all hand parts, is very important to be implemented. Second point in the standard precaution is the personal protective equipment, PPE, like gloves, gown, mask, head cover. What we need to know about the PPE, it is the indication of PPE and the sequence of donning and doffing of a PPE. PPE assigned for patient care only and according to the risk from the patient. The purpose of a PPE is to create a barrier between the healthcare worker and the patient body fluid. So according to the risk from the patient, we wear the PPE. For example, if there is a risk to expose to body fluid from the patient, in this case we will wear the gloves. If there is high risk of splash, we wear gloves, gown, and face shield. If the patient has a risk for respiratory infection, coughing or sneezing or something like that, we wear the mask. So according to the risk, we decide what is the type of PPE needed for us. Very important notes and alarm that all PPE should be used only during patient care as indicated and should be discarded immediately after the patient care. Not allowed for us to wear PPE and go through the corridors or transfer from one room to another room or get out from the patient room to the station. So all PPE should be discarded immediately after the patient care and not allowed to get out from the room with any PPE. Also not allowed to us to use the same PPE to give the care for other patients. When we finish the patient care, we remove or discard all PPE and make hand hygiene and wear new PPE for the new patient. This is a sequence for donning of PPE. We start with gown, mask or respirator, goggle or face shield, and finally the gloves. For doffing, we start by the gloves, which is most contaminated. Then we can hygiene maybe, we can do it. Then the goggle and gown, and finally the mask. All PPE discarded in the patient room, except the mask will be discarded outside the patient room. Also, all PPE will be donning in the ante-room, not inside the patient room or outside, in the ante-room. And this is the pyramids of the gloves using. We have sterile gloves, we have cleaning gloves, and we have some procedures not in need for any gloves. We have two types of the mask. We have surgical mask and mask N95. Surgical mask, which is used when there's risk of respiratory infection or when we care for patient under droplet precautions. Mask N95 used only for patient of airborne infection. And before using mask N95, the healthcare worker should undergo two fit tests to decide what is the suitable size for him. Third point of the standard precaution is the handling or disposal of contaminated items. Contaminated items like needle or sharps, linen, medical waste, patient care equipment. We will start by the needle. Keep in your mind all the time that when we caring with needles, we remember that one needle for one syringe for one time will equal 0 infection. And all the time we must escape from the needle stick injury. For management of the needle and sharp, dispose used sharp items into approved malculture resistant container, which is a sharp box as a point of use, or close point as soon as possible. So not allowed to us to use the needle and go long distance to discard it. Sharp box should be available near the patient care area. Don't please use the sharp items on any environmental surface, because in this case, you expose your team to risk for needle stick injury. Don't recap or manipulate needles using both handles. If it's necessary to make recapping for the needle, you have to use scope method or one-handed method. Close the sharp container when be 3/4 full and remove for incineration. This is the protocol for management of needles. What about linen? Handle and transport linen in a manner that prevents skin or mucous membrane exposure and contamination of clothing or transferring microorganisms to other patients. Place wet or heavily soiled linen in a designated impermeable bag and close the bag securely. And wrap wet linen in other pieces of linen to avoid soaking of bag. It's very important that you have color coding for the contaminated linen. For example, the linen from isolation room or contaminated with patient body fluid should be bagged in special color coding bag at the site of the patient care. Don't take the linen from the patient room outside. No, take the bag to the patient room and put the linen inside the patient room and secure it and transfer it to dirty utility room to transfer to the laundry. Handling of medical waste. Of course, inside the hospital, we have different types of the waste. So each type has a specific way to be discarded. We can create a scheme like that for any hospital, according to the hospital policy. For our hospital, for example, we have green bag for the contaminated linen. We have black bag for the general waste. We have yellow bag for infectious waste, contaminated with patient body fluid. Red bag assigned for human tissue, like placenta or any human parts. Sharp box for any sharps and needle, and orange bag for any chemical waste. According to your policy, you can create something like that to be oriented for all staff and distributed for all departments. For the patient care equipment, it's very, very, very important that don't use any single-use items again. Any single-use item should be used for only one time and then discarded. For reusable items, should be transferred to CSSD. Not allowed for us to make cleaning or brushing or anything for the items in the patient care area. We have to provide closed boxes which contain the used items, then transfer to CSSD. These containers should be labeled by biohazard symbol, and just only we can spray enzymatic detergent for the used items, it will transfer to CSSD. Remember that all decontamination, cleaning, and sterilization of medical equipment should be done only in Central Sterilization Service Department. We allowed only to make soaking for the used instrument and suitable detergent and disinfectant and send it to CSSD. Point number 4 in the standard precaution is the management of lab specimen. Before collecting lab specimen, we have to wear clean gloves before blood withdrawal. After we collect the blood, we have labeled the tube with all patient data. Then remove the gloves and make hand hygiene. Put the tubes in closed containers and create the request for the lab containing all patient data and all tests required from the doctors. Point number 5, room cleaning. Rooms should be cleaned daily and after patient discharge. Cleaning is required as per housekeeping policy. Cleaning schedule should be available everywhere and implemented. Any patient care area should have cleaning schedule submitted by the housekeeping and health supervisor. Patient placement. The meaning of patient placement is that infectious patient or suspected patient with infectious agent should be admitted in a single rooms. Not allowed this patient to be admitted with other patient. He will be in single room, and cohorting allowed only with other patient with the same infection and the same microorganisms. If I have patient, for example, have pneumonia, should be admitted with another patient with pneumonia with the same microorganism. Cough etiquette is meaning that not allowed for us or the family or visitor to make coughing or sneezing in the air on his hands. It's prevented. Coughing and sneezing should be implemented by using a tissue or our sleeves to prevent these particles to spread in the air. And then after using this tissue will be discarded in medical waste and make hand hygiene. This should be implemented by all healthcare workers and make orientation for all visitors to do that. Last point in healthcare standard precaution is the food and the drink at the workstation. Completely, it's forbidden to use or keep food and drinks in the patient care area. For the staff, should be available special room and special refrigerators for your personal items. This 8 points is called standard precaution, which should be implemented all the time with all patients. We will transfer it then to isolation precautions. As we said, isolation precautions depend on the mode of transmission. It will be divided into contact, droplet, and airborne. For contact precaution, the most important PPE will be gown and gloves. For droplet precautions, surgical mask is enough. For airborne isolation, we have to wear mask N95 and do fit test before it. The contact transmission may be indirect or indirect way, and the same result will be appear. Direct contact, like direct body surface or body surface contact, or physical transfer of microorganisms between two patients or between patient and staff. Indirect, that one staff may be carry from the patient some microorganisms and transfer it to the nursing station, and other staff we can collect this microorganism to be infected or infect another patient. Examples for contact infections like MRSA, VRA, herpes simplex, zoster, or any wound discharge or lesions. Our precautions for contact infections: the patient should be admitted in a single room, and before entering the room, we have to wear gloves and gown. If the patient will transfer to another department or another hospital, we have to hang this isolation card for the trolley or the wheelchair. And this is a precaution should be done during patient transfer. For droplet precaution, which the droplet are generated by the infected person by coughing, sneezing, or talking, or during the procedure like suction of person with respiratory tract infection. These droplet microorganisms can be transferred within 1 or 2 meters and can be hanging in the air for a short time and then will be settled on the surface. This particles is bigger than 5 microns, so it can't be hanging for a long time or can't be transferred for long distance. And this is the difference between droplet and airborne precautions. Some example of droplet precaution like influenza, pneumonia, mumps, and others. Our precaution when the patient admitted in a single room, and these isolation signs should be posted on the patient room, the room door. And before entering the room, we have to wear surgical mask. Surgical mask beside the standard precaution. For example, if this patient has risk to expose the staff for body fluid, in this case, we will surgical mask, gloves, and gown as a standard precaution. But if there is no any other risk, so surgical mask is enough. And during patient transfer, we have to hang this card on the trolley or wheelchair. Airborne microorganisms is very small microorganisms, less than 5 microns. And because of this 5 microns or small size, these microorganisms can be transmitted for long distance and be hanging or suspended in the air for a long time. That's why it's called airborne infections. In airborne precaution, we can't wear surgical mask only because surgical mask will not protect us from these microorganisms, as they can pass through the pores of surgical mask. So we have to wear, in these cases, mask N95. Examples for airborne infection like TB, measles, chickenpox, SARS. Remember, very important point, that any droplet infection can be changed to airborne infection during aerosol generating procedures. We have one clear example nowadays like COVID. COVID mainly is droplet and contact. But if this patient is ventilated or undergo for aerosol generating procedures, our precautions will be contact and airborne, not droplet in these cases. And this is the isolation signs, as we said before. This important PPE is a mask N95, and during transportation, we have implemented these precautions. Aseptic technique and device management. Aseptic technique like intravenous infusion procedures or catheter care, suctioning, wound care, and ventilation of the patient. Aseptic technique definition, it meaning is that implement some practice to reduce the number of microorganisms on hands or supplies or in the environment to be transmitted to the patient. An aseptic technique component like approved attire, this attire for staff and for the patient. For the staff, for example, we have to wear surgical or clean gloves, gowns, mask, and sometimes for the patient, all the patient surface should be covered by sterile drapes. We have to implement hand hygiene. Then we make skin antisepsis by approved antiseptic. For the items which will be used for the patient, if it will be single-use items, should be discarded immediately after finished. Any aseptic technique should be implemented in clean environment. This is a component of aseptic technique. And this is clean technique. In clean technique, the difference between and aseptic technique, we can wear here clean gloves. And we implement clean for non-invasive procedures. But invasive procedures should be implemented by aseptic technique. Safe injection practice. Single dose vials for the safe injection practice, use single dose vials whenever possible. If you have multiple dose or multi-dose medication, must be used for single person and will be labeled by the patient data. And for every time we use this multi-dose medication, we use new syringe and a new needle. Don't keep a multi-dose medication in patient care area. Storage of multi-dose medication should be done by manufacturer recommendation, and the label multi-dose medication should be labeled by the opening date and expiry date. Expiry date maximum will be 28 days from the opening date. As we say, expiration date for any multi-dose medication should be discarded after 28 days after the opening. Okay, now we will talk about needle stick management. If any healthcare worker has needle stick injury from one patient, what is the management protocol? First, no squeezing for the injury, because squeezing will open your blood vessels and will help any virus to enter to your blood vessels and make infection. So no squeezing. Encourage you. When to bleeding under running water, disinfect it. Then notify your supervisor and notify infection control and submit OVR or instance report. Remember that one needle, one syringe, one time will equal 0 infection. The same steps we will do when body fluid exposure to healthcare worker. If you have any open wound or an intact skin and exposed to body fluid, wash it under running water, clean it by soap and water. And for your eyes, if exposed to body fluid, irrigate immediately with amount of water using either running tap water or eye wash bottles. Management of spill, it depends on the type of blood spill kit and according to the hospital policy. We have manual spill kit prepared by the hospital staff, and we have also ready blood spill kit can be brought directly from the companies like 3M. And the sequence of cleaning the spill depends on the type, but generally we will talk the main component of blood spill management. First of all, if this spill contains any glasses, should be collected by forceps, not by the hands. First point of the blood spill management, put warning sign to prevent anyone to go through this spill, where the housekeeping or the staff nursing, according to the policy, will wear all PPE, surround the spill by tissue and cover it by tissue. Then collect the liquid by tissue and discard in the yellow bag. And you have to have two solutions: detergent solution or another spill kit powder, absorbent powder, and Clorox solution. Spray the detergent or absorbent powder to the spill, then collect it and prepare fresh Clorox solution 1 to 10 Clorox and spray it and leave it for 5 minutes on the spill to ensure that all microorganisms or any virus in the spill killed. Then clean the area again and discard all the tissue on the biohazard bag. And make hand hygiene finally, and make incidents report. This is another steps for hand hygiene for blood spill management when you have absorbent powder instead of detergent solution. For staff immunization, all employees in the healthcare facility should be screened for hepatitis C, B, and HIV and TB. For the new hiring staff, should be screened for hepatitis B, measles, mumps, rubella, varicella, and the staff which is not immune for this disease should be start vaccination for these diseases. Here we have examples for the most common vaccination of healthcare workers, which should be implemented. And that's all we have today. Thank you so much for your time. In Squeeze, we can accept any comments or any questions in our page on the YouTube. Thank you so much.